Hello and welcome to PM Express. My name is Nana Ansakwa. Now today we are looking at our attitude towards mental health. As a state, as a people, our attitude towards mental health. It's been, the stigma, the neglect, the will, the passion, everything towards mental health is really, really lacking. And today we hear that the mental facilities, the only 3 of them in the country, are saying that they will not last beyond 24 hours. They've literally run out of food and items and everything to take care of their patients. I have with me in the studio Dr. Eugene Dodwe, who is a psychiatrist and Ghana Health Services. We're not focusing too much on the fact that they're going to close in 24 hours, but we're looking at ourselves as a people and how we treat people who are mentally challenged and how we treat the facilities where mentally challenged are supposed to go and being careful and find out what is the root, why that in 2013 we're still even talking about this issue, whereas others have really gone past this stage. Doctor, welcome.
Thank you very much for having me.
Doc, I know once upon a time, if somebody was mentally challenged or you're living with a mental condition, they used to chain you.
Yeah.
If it was severe, they even burn you because they didn't even understand. And then we moved from chaining and burning to sort of caging them, literally put them in cells.
An asylum.
And asylums. And then we had their own segregated hospitals. I don't know, is that what's considered as asylum?
Yeah, that's what the UK called the mad houses.
Mad houses. Then they moved from that to put them now in mainstream hospitals.
We moved from there to put them in psychiatric hospitals.
Okay.
Or what the US would call the hygiene sanatoriums. Mm-hmm. And then now we moved beyond the psychiatric hospitals to put them part of the general healthcare. Mm-hmm. So in every hospital, just how we have diabetes clinic, we also have a mental health unit, a clinic that's also for that condition. So it's just to improve the care. We see them as, because we've moved away from the mind and the body being separate, and we have, mind or mens means mind. So psych, mens, all mean mind. So mental means of the mind. Psyche or psychology or psychiatric means of the mind.
Okay.
So we formerly thought that there was a mind-body dualism. That is, mind and body are different in terms of how they act. But now we know they very much interact and they are inextricably related. Mm-hmm. So most things of the mind affect the body, most things of the body affect the mind. So it does not really make sense to separate the two conditions as if they are not related, and therefore you treat mind diseases somewhere and treat body diseases somewhere. Now the knowledge now is that the two interrelate. So treat them together so that we have doctors around, they can share ideas, they can relate and say, no, this one appears to be mental disorder, but I don't think it is. So let me call the doctor who takes care of the brain alone, or the doctor who sees the neck alone, to come also have a look. Then we work hand in hand, and then so that we give a holistic care, we give a total care, and not to treat mind as somebody who treats the leg, because it's the whole body.
One thing is, I know that these changes moved in periods. The days where they used to shackle was, really far back.
That was in the 19th century.
19th century. And then, it lasted for a period before they moved.
Yeah.
We seem to stuck somewhere in the 40s or somewhere, and we did not follow the world to today. We just got stuck in the asylum stage, and that would say...
Maybe I would say not 40s, but rather a bit...
Maybe a bit 50s, yeah? So we got stuck in the 50s.
Yeah, because that is when we invented drugs that can treat psychotic conditions.
Okay.
So when there were medicines that we know could treat them, could make some of them better and not really need the change, because some of them were able to come back and have a normal social functioning. Mm-hmm. So with that, there was really no need to create asylum. But if you still have a place called asylum down, as of today, and we still have a hospital in Accra, built like a prison. You know, we have the high windows. It tells you, so the very edifice there, physically, tell you that we still think that these people should be kept somewhere to keep the public safe. So in effect, we are not thinking of them. We are being selfish. We are thinking about ourselves, that because I think I may be harmed, let me lock this person up somewhere. Let me keep them in an asylum. So if you watch, Adabaka was actually a bush when they put up the mental hospital. And when that became part of the town, they moved it to Pantine, which is far from Accra. So let's put them away. And you see Kwame Nkrumah built Ankafo, where we have the leprosarium, we have the prisons, you have the mental hospital.
But that was the thinking at that age.
That was the thinking at that time. Look at those Kwame Nkrumah's time, in the 50s, in the 60s. Yeah, so that was the thinking at that time. Now we've moved on. We've moved on.
You see, but my question is, why as a state, why haven't we moved on? The state, who is responsible for also changing, as you doctors find new research, you say, oh, then let us also move on. Why are we stuck in that era?
I wouldn't say we're stuck in that era as a state in totality, because some part of mental health care has actually moved on.
Okay.
I was trained in Ghana. I'm a local breed. I had my medical education in Ghana. I had my postgraduate training in Ghana and everything. So we've moved on. We can train and learn in Ghana. Now we even train mental health nurses in Ghana.
Okay.
UCC will be doing a degree in mental health nursing and all that. So for the training, we've moved on. What we have not moved on is the state moving on with their structure and the mindset to manage the people. So this goes beyond the individual healthcare providers. This is about the states not recognizing that we don't need to keep people in asylums again. I understand the health minister wants to expand Pantine Hospital. My understanding is that hopefully they want to make it a bigger general hospital where they also have mental health care services.
And not a big...
But if it is to create a bigger mental hospital...
Defeats the whole object.
Yeah, then that takes us back to asylum age, where we think that when people are mentally ill, let's confine them somewhere. And that thinking is what you say we've not moved on. For that thinking, so when Kwame Nkrumah built these institutions, that was the thinking at that time. That yes, let's build them asylum, let's build them places where they can be kept. But now no. So that is where we've not moved on. But even then, there has been a bit of progress. As we have passed the mental health bill, now it is a law. So hopefully, if the board of the Mental Health Authority is established, I understand it is not yet established. If it is established, then that law requires that we should have a mental health unit in every district hospital or in every regional hospital. Then we can treat these conditions. So if you put that juxtaposed with expanding Pantine Hospital, the two really does not go, because you cannot want to put mental health unit in every hospital and then want to expand one mental hospital to make it bigger. The best thing is to what we call deinstitutionalize them. So let's treat them in every hospital. Then we can have them. But we are a long way from there.
Oh yeah,
because we don't have the human resource.
You see, we want to all see, everyone go to Kolebu or 37, and I'm coming for a toothache, he's coming for a leg ache, the other person is coming, to check, his brain to make sure it's fine or not fine, whatever it is, and it's all fine. Sure. With the stigma going around, how are you going to treat the wards? Can you imagine if I was bringing, my mom or my dad to come to the ward because he or she's got maybe a slip disc, Somebody also is bringing his dad because he, have a mental illness. With our stigma that we have, hey, no, he's going to get up in the night and then harm my father or my patient because he's mentally ill and he's only got a slip disc. So how are they going to manage this ward? Especially, with our thinking. How are we going to take that?
Yeah, so one, there should be a policy change that make the thinking go along with it. But that is not really different from general practice because, let me take a typical example. A young woman comes to the emergency with a lower abdominal pain or with an abdominal pain. It could be something like appendicitis. It could be something like a pregnancy, which has been, like an ectopic pregnancy. It could be a diabetes. So in every hospital, when patients come, people might think it is this. So we sort it out and then we put them in. So if you have a gynecological problem, send it to the gynae. So the same way, somebody behaving in a way coming does not mean the person has a mental problem. And that is exactly what the world has come to learn, that mind and body dualism. It's not really it. I continually see patients in the mental hospital who have been wrongly referred because they were behaving abnormally. But their abnormal behavior is not because they have a mental problem, but because they have a general medical condition which is treated in the general hospital. And we find ourselves having to send a patient back who might have traveled because, unfortunately, all the mental hospitals are 3. 2 of them are in Greater Accra, and the other one is in the neighboring Central region.
Wow.
And these are only the 3 just clustered around one small area.
So what if I'm in Wa?
So if you're in Wa, you have to come down to Accra or Cape Coast. Only for me to tell you that, what is happening is not really a mental problem. So you should go to the Tamale Teaching Hospital. So, and that is why it will not make sense to concentrate a mental hospital in one area. Because some of them may appear as such, appear like mentally ill, but they are in fact not a mental illness at all. But to take a specialist to tease these things out, that yes, I've checked through, this is this, so let's do this condition. But so if we don't really practicalize the law to make it effective, so that we have mental health services in every unit, every district hospital or any regional hospital, then we actually increase the costs of mental health care. And we also deny many people the access to mental health care. Because, sometimes it's very terrible. Somebody travels for about 10 hours to come and see you, only for you to tell them that, I'm sorry, it appears you had a mental problem, yes, but it's not really. So we are not the ones to
look after you.
It's so pathetic. So sometimes we are forced to treat them and run as a general hospital. And so I end up seeing many general cases as well. But that shouldn't be it. So if we are all together, we all work together. So, I saw this case.
I agree. You see, what I'm saying is we agree. But with the patient coming to the hospital, the stigma that we all have, that we have grown up with, I won't, or somebody who said, I don't want to be in a ward knowing that the
next patient
is a mentally ill patient. So then you're now going to have to deal with even the patient that are coming. And I'm thinking, have we thought of that?
Yeah, we have. Because unless maybe people have a prejudice idea about who a mentally ill person is. Well, because most often we don't even know who a mentally ill person.
Okay, you see, Doc, I know...
Unless you mean the aggressive, agitated patients.
No, sometimes not necessarily aggressive. There was a guy who lived next door to us, Billy, right? He wasn't aggressive, but he wasn't very well kept. He was very dirty. But he wasn't aggressive. He comes to the house every day.
Those who are that unkempt, who are aggressive, they are in the minority. Maybe less than 5%.
No, he's not aggressive.
Yeah, those who are unkempt and who are aggressive, I'm putting them together.
Okay.
Because those are usually a mental illness left untreated
for a long time.
And they get there.
So
So if we intervene early, we will not even see these things.
Okay.
Yeah,
okay.
if we intervene early, we will not even see these things.
And if we have the hospitals together, then you will intervene quicker.
Then they will come. Because as soon as people start observing some behaviors, they will seek intervention. And fortunately, I mean, from the 50s now, we are in the 21st century. Now there are newer drugs which work so well that people can actually go back to their normal work. I mean, we're able to there are people who we can get back to do their normal duty. I mean, all they do is just to take an injection every week, or I mean, every 2 weeks, or every month, or some of them just take a tablet every evening, and they are perfect. Right. Just like we manage hypertension or diabetes. So it's not like the ones left untreated. It's more because we have this, I'll call it a sick system, where we put mental hospitals down south the country. So before I will travel to down south from the north, I should be sure that it is a mental illness. And that means I should have left it to get to the west. Because like if I'm not sure, and it is something like a mental illness, I will not travel from Tamale, I will not travel from Kumasi to come to Cape Coast or Accra just to be told that it may or it may not be.
Let's look at conditions. Conditions are very, very, very bad in maybe all, but I know the Asylum Downs condition there is not the best. You don't have to put any human being, even murderers, don't go through such treatment. But you don't hear the relatives of the patients kicking up and down that, no, you know, I send my daughter here, or I send my niece or my child here, and this should not be so. So, and they are like the immediate people who should have felt and fought for, you know, their patient, but they are not. So then, if you come further back to somebody who hasn't got an immediate relationship, and then you go further back to the state, you think maybe they are not pressing the right buttons.
You see, they say something in Akanda, Okona Sonya Bitwa, and I was trying to so. Meaning that when you go and there is some available for you to buy, that's when you can ask that they can give you a discount so that you buy more. But if you went and the product is finished, you would obviously will not go and ask for a discount and ask me that, let me buy more. You see, the people don't have access to mental health care. It's not there. I mean, the three hospitals cannot, we have about 95% unmet need in Ghana.
Wow.
90. So for those who are mentally ill who need help, we only see about 5% of them in the country. So it's not like they have a choice. So for them to come and demand that, I mean, I don't want this condition. Well, anyway, if you don't want this one, which one do you go for? So that is where, as a country, because we say that a chain is strongest at its weakest link. A state is considered a state if they can care for their most vulnerable. Mentally ill are the most vulnerable. Because if people are blind, you can train them. They can care for themselves. People can hear. You can train them. But when people are mentally impaired, what do you train?
You need to get them better.
Yeah. So the brain is kind of the core. It is what is when it is working that you can get the other parts of the body or the human being to work. And this is where we have neglected so much that, I mean, even though the conditions are appalling, the people keep coming because we always have over, I mean, our bed capacity is always, I mean, oversubscribed. I mean, we get over 100% bed occupancy because they have nowhere to go.
Wow.
They go to the prayer camps and they are chained. And they want it because otherwise, what else can they do? So as a state, we've not offered people the treatment options. They don't have any place to treat their mentally ill. This is even before they even decide whether this person is even mentally ill or spiritually ill. So even when they agree that this person is mentally ill, there are not enough avenues for them to seek help.
Wow.
So if you come and this is what we have, like a dungeon, and you don't want it, you really don't have a choice. So I think it's more of a state not attending to people with mental illness. It's a state not really giving much attention to our mental health needs. You know, I had an exchange in Italy when I was in medical school, and I told them I wanted to do mental health, after school. Then the guys look at me and ask me, do you have mentally ill people in Ghana? Because they see Africa that there's no stress. Mm-hmm. They have the stress, so they get the stress-related conditions. So they think we don't get mentally ill at all. I say, well, the mental illness we see are just not just the mere stress that you guys are worried about. We see worse ones, but the people who are very ill, they left untreated. There are some of the conditions like catatonic schizophrenia. It's a very worst form of mental illness. And the books will tell you that these ones are not common because now there are medications. But we see them in Ghana.
Yeah, wife killings. Now you pick up any book in your wife killings and wife killings and wife killings, and I'm sure there will be a link in there somewhere.
I saw a patient yesterday, and because of confidentiality, I cannot tell where he's coming from and all that. And this young man, has been put in locally manufactured handcuffs and shackles for 3 years. 3 years.
Wow.
He only got access to mental health care because a court has ordered it when he raped and killed a boy.
Wow.
So for 3 years, the family knew he was ill. That is why they had to keep him in chains and shackles.
Wow.
They knew he was ill. Again, you cannot blame their family so much because
where
they are living, where should they access health care? So until the court ordered it, which now they have to because it's a court, like this young man wouldn't get health care. And this health care is a basic right. It's a basic right. So when people can't access health care, and mental health is a basic need. I mean, you can't have health without mental health. So if we don't pay attention to mental health, probably many of us will need mental health assessment. Otherwise, it's quite I find it very difficult to comprehend why we neglect mental health in this country. I find it very, very sad.
Talking about neglect, and if you don't want to go there, we won't go there, but to say that you're running out of supplies, I know maybe there might be some technical gadgets that are expensive and everything, but some of the things that you're complaining, like, diapers, that's like, toilet roll, or that's the basic of the basic. So if the hospital is run out of that, I'm sure people listening out there will be a bit surprised.
Yeah, the challenge there is mental health care by law is free.
Okay.
And that has become an albatross now. Formerly, when it was cash and carry, it was good for us because it allowed people to access mental health care. It kind of removed the barriers so that you can access health care. But now there is health insurance, and people who don't have insurance pay for the service. Mm-hmm. But we have maintained mental health care, tuberculosis, vaccinations. These are still free in Ghana. So if they are free, meaning that everything should be free.
Yeah.
So until government give its subventions to the mental hospitals, it can't run because we don't generate any income in there. So we are unable to kind of claim money from health insurance because I cannot claim money from health insurance because I'm taking care of somebody mentally. So that money will not come from health insurance. We cannot. So until we get money from governments, and for some time now, almost all ministries and government agencies, all the MDAs, we don't get our regular quota on time. So when it hasn't come, you wait. And this has been a bit consistent for some years now. So, our debtors know that these guys don't pay. So now when they come again, You know, mental health now it's been shown over and over again that you guys don't pay. So nobody really to prepare to lend you, I mean, to like credit you anything again.
How about?
So it's quite difficult to run the facilities now without government
Intervention.
fully. I mean, it should be full. You see, government is not just required to intervene because it's a free mental health care. That is what as a country we have agreed to do. So if it is free, then it should be free.
The churches, the big companies, the big corporations, average citizens, are they not helping, donating, something to keep you going while government is still trying to find some money to buy maybe the big machines, at least the detergents and Milos and stuff here and there?
Yeah, I'm not sure anybody has come and we said no. Sure, I mean, because we are always with open arms, we'll thank you and we'll bless you with whatever God we believe in. And we are always prepared to receive anybody. I mean, if anybody wants to help, why not? We always accept it. Because apart from the help that people give us, which will readily accept, it's also a kind of therapy for the patient to realize that there are other people out there who care about you. It's not like you are less human because you are sick. Because any of us can fall sick. I don't want to feel tomorrow that when I'm sick that I am less human just because I am sick. Because none of us want to fall sick. Nobody prays to be sick. Mm-hmm. So if we are unfortunate and we fall sick, I should not be treated as if I'm less human. So when people come around, come and show love, the human love to us, because every human being needs love. So when they come around and give us donations, sure, we will gladly accept it. But I don't know whether you can, as a manager, if you're made a manager, you can plan and run a facility with donations when you are not sure when they are coming. I mean, this is obviously, I don't know how any facility can run like that. So when these things come, sure, we take them. But since you can't pledge on donation, even our multinational donors, when even they even promise, they don't even deliver every time. So how much more people who have not even promised us yet, and we wait and hope that they will bring it. Something. We cannot plan with that, and it will be difficult to run a facility, I mean, based on that.
You see, I think we've all played a part one way or the other in terms of our attitude towards mental health. We are all guilty in one way or the other, maybe directly or indirectly. I
perfectly agree. I'm directly. I mean, we all see our colleagues on the roadside. I wonder how many people will see an accident victim and just drive by. We all try to help. So why don't we help people who walk unkempt by the roadside? What crimes have they committed?
We'll be right back. When we come back after the break, I want to look at the stigma. I want to focus on the stigma and see how we can change that attitude. But before I do that, if you're a church out there, you're a big corporation out there, you're a big company out there, I'm sure, a bit of corporate social responsibility, big box of loo roll or detergent, they will bless you with whatever God that they believe in. Stay tuned. Hello, welcome back to the show. Stigma. Now, when we were growing up, there was Jolo Jolo who lived in the area. Obviously, had a mental problem, unkept. He wasn't violent, but there was this story that Jolo Jolo is scared of the police. So we all run after him and shout that the police is coming, then he runs away, and then we all have a laugh. Now, 20, 30 years down the line, people my age group are in places of power who have to sign papers or who are in places of authority. They now have to make a decision to make Jolo Jolo's life better. This person has grown up in a system which never valued Jolo Jolo. He's mad, he's sick, whatever. Doctor, the people who run the state at every given time are the same people who, like me, were running after Jolo Jolo, stoning him or teasing him or shouting that there's a police coming. Now they need to sit in their office or their private and make a policy and pass a bill and actually donate money towards his cause. They don't have any feeling. They haven't been brought up like that.
The sad thing is that people think such patients are mad.
Well, that's what they say.
Yeah, I mean, they are not. They are sick. You see, if we are able to change our attitude, our thinking, that it's not that he is mad, but rather he is sick. Because we treat the sick. Mm-hmm. When people are ill, they should be treated. And here, let me add even the addiction, alcohol and drug addiction. These are diseases which are treatable. So when somebody is alcoholic and you fire them from work without giving them the option of treatment, it's just like sacking him for being sick. Then the similar one I will say about is suicidal behavior. In this country, we punish them. So it's more or less saying that because I have a fever, I should go to jail. Because people are suicidal because they have a depression or they are mentally ill. And then you punish them for being ill or for showing their symptoms.
Doc,
it doesn't make sense.
I want to go back to...
Yeah. I'm trying to...
You land on it, right?
Yes,
okay.
I'm trying to get there. So basically, what we are trying to say is that, let me give you the last example. In our law books, in our criminal law, and we still maintain the words idiots and imbeciles. An idiot is somebody who has a impaired mental intelligence, who has impaired intelligence that is up to about 0 to 6 years. That is, maybe from birth trauma, they were damaged and the intelligence could not grow beyond 6 years. We call them idiots. That was an old term which British dropped in the 50s. And we keep it in our law books now. Imbecile are those who are mild to moderate impairment, in intelligence. And we call them imbeciles, Jimmy or Bulu. So these are people who we have failed to realize they are sick. And rather label them, call them Jimmy, call them idiots, call them imbeciles, call them stupid people. Just because by God's grace I wasn't sick, I had a delivery that was able to protect my brain, and I was able to go to school, and I can now understand things. Now I should refer to the other person who, unfortunately for him, one healthcare provider, or because he didn't get access to even healthcare, how to deliver at home, had a birth trauma, suffered something in the womb, and now comes out impaired. I refer to him as Jimmy. Refer to him that he is stupid because he didn't get the opportunity that I got. And that is how cruel we are as a people. That yes, you came out by your own fault, you are sick. That is what we are saying. That because you are sick, you should be downtrodden. You should not be human again. Because fortunately for me, I wasn't sick. As if I created myself and I can make myself well today or tomorrow. And that is how we see ourselves. And that is the unfortunate thing that we all grew up thinking. Because many societies now, when a woman is mentally ill, they say it's the husband or the relationship that made her ill. When a man is ill, they say, oh, he smokes weed. That is not always the case. People genuinely fall sick mentally ill. And we have no right to punish them for being ill. So for we not making healthcare accessible to them, and we labeling them, as we say, give a dog a bad name and then hang it. Mm-hmm. So by we labeling them, we then stigmatize them. Like what is unfortunate too is also in the media.
No, you see, before you move on, what I'm saying is, I agree with everything that you said. This really cruel upbringing that we have all got. And you hear, little Amma, hey, don't go and play with Kofi because he's dribbling. Don't play with this one because he's got some even polio. Don't
epilepsy. Epilepsy is not even a mental disorder. They are stigmatized.
Yes. So little Amma or little Kofi grows with all this idea that I'm not allowed to play with him because he dribbles. I'm not allowed to play with her because he's got epilepsy. And now Amma becomes, somebody of, in a position where he or she has to take a decision to protect the guy who was dribbling. And he's always grown up to know that this guy is an idiot, an imbecile, Jimmy, bulu, bulu. So I think we have cocooned ourselves and that we cannot think beyond it. And I'm wondering, do we need to bring a new generation who think beyond this? Because as for this generation, I don't see hope.
I think what we need to do, if the media, for instance, can take a tenth of the time for politics and then educate us. Because for me, it is still a shame to maintain a word like idiot for a human being in our law book. So, legally we call some people idiots. So if we are able to educate ourselves, because stigma is mainly from ignorance. Mainly from ignorance. And it's not only us, it's happened the world over. Because the word malaria is basically from mal air. When the Portuguese thought that the evil air around black people gave the white people a fever and they made black and they die. So they call it malaria. That is bad air around black people. A seizure means a spirit outside you has seized you, and that's why. So we all thought, even the Westerners were also superstitious. Mm-hmm. But when they gain knowledge,
they let go of it.
They let go. Now we go to school, where the people who make the policies, almost all of us, have gone to school. Before you can become a minister or whoever, you must should be able to speak good English. And most of us would have gone to school. So we have failed to use our education to benefit the majority of our people, Ghanaians. And that is why I think we, the elites, have failed the populace. Because we have not used our education to improve the lives of our people. When you go to the West, people go to school to improve the welfare of their folksmen. We go to school to improve our lot, our personal, selfish lot. And that is unfortunately what we have. Because otherwise, why would we treat somebody who is mentally ill, more or less punish them for being ill and not see that there's another human being who I should have compassion on and do something to help the people. And mental health is one thing that no donor will help you, treat you, because you see, mental illness is not infectious. Epilepsy is not infectious. The saliva from an epileptic, when they are foaming, won't infect anybody. If you touch them, it won't infect anybody. So no country will come and donate money to you to treat you mentally ill. Because you see, unlike tuberculosis, when they know that if they don't treat you, you also come and infect them. So they will donate money to treat HIV. Because HIV can also infect them if they don't treat yours.
Doc,
but for mental illness, it won't infect them. So we have to take charge of our own. That is why as a country, as a state, we need to take charge of our mental health care. Nobody will do it for us if we don't do it.
Doc, is it might be a silly question. Is it a majority or is it a minority of this attitude? Is it the majority of us or is it a minority of us?
Unfortunately, it's the majority of us. Because even healthcare providers stigmatize, even among us.
Are there people amongst us who help the mental health?
Yeah, there are a few NGOs who basically decide to help in mental health. We have Mind Freedom, we have Hopeful Way Foundation, we have Basic Needs. These organizations just are there to help mentally ill. I know the Catholic Church has a rehab center. Duncan Williams Church also has got a rehab center just to help people with drug abuse and alcohol. So the church and some organizations are helping, but it is not enough. It is just a drop in the ocean.
What keeps you in this sector? Because you've educated yourself, you've acknowledged the wisdom, you are willing to work, and the system is against you. What keeps you in work? What makes you want to wake up tomorrow morning and drive there knowing that I have no Pampers, maybe some drugs that I'm even going to prescribe for my patients may not be there. What keeps you going?
What keeps me going? One of them is the motivation from my boss, Dr. Akwesi Osei. He always tell you, let's not punish the patient for the sins of the state.
Okay.
Yeah, I mean, this person has come here today because he didn't have healthcare in Brunahafo, in Western region. The state should have provided it. So if the state, which I'm part of, did not provide it, should I punish him for the state not taking up their, responsibility? So that passion, that why should a fellow human being suffer? Because the motivation here is that I know that when I treat this person, he will get well. When this person gets better, he will say, thank you, doctor. I mean, they will appreciate what you've done. So that alone, and if even I have no supply, no drugs, the fact that I can touch them, hold them, gives me joy that I can also show love to another fellow who everybody else have neglected. The bigger challenge is that it's difficult to tell other young doctors to come into mental health because it's what is in there for me. It's difficult to get nurses to work in mental health because what is in there for them. But even can I believe we are also stigmatized, even as the professionals. We are stigmatized. You know, people tell us that we behave like our patients, but nobody tells the pediatrician that they behave like the children. And organic also behave like women. So what makes people think that we behave like our patients? So there's always things that people will use to stigmatize you. And whatever you do, if you don't really have the love for the job in this country, you can't be in mental health. That is basically it. So if you've seen my boss, the passion with which he works, if not the passion, really, there's nothing that will keep him, in the sector. Because it is deplorable.
We have all seen the sector.
Very deplorable. It's very, 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 deplorable. And for me, the danger is that the future is bleak.
I was going to ask you, how bad is the mental health system?
I would say it is.
Give me a graphic picture.
It is terribly bad. Terribly bad. Let me start from the human resource. We have only about 12 of us, 12 psychiatrists in the country.
For the 25 million of us?
Sure. So 1 to 2 million.
I see.
And not less than 1 million of us will need healthcare. Mental healthcare in 1 year. Not less than 1 million. So, and if there are 12 of us, how do we work?
And where would I find the 12? In Accra?
In Accra and Kumasi. And now in Cape Coast. So Accra, Kumasi, Cape Coast.
That's where the 12 of you are?
All the 12 of us. So when you go up north, nothing is there. As if, do they matter at all?
So do you have maybe one Sunday of a month that you travel to the north to do some, like a workshop or clinic?
Yeah, we do. We have medical outreaches. Mm-hmm. We go up north, we go upper east, upper west, northern region. Now there's some in central region and western region. For Kumasi, because of Kofanoche, we don't really go there. We have community mental health nurses in Volta region and other, but some of them will need a specialist attention. We cannot leave all of them to once a month doctor coming to see patients. So in between, because let me give you a very a picture about some of the cases.
Doug, hold on. Before you come back, we'll take another quick break and then we'll come back and continue. Well, we're looking at how bad things are. 12 psychiatric doctors in the whole of Ghana. I think that is way too little. But doctor is pouring out now to tell us how bad things are. Stay tuned. We're going to be right back. Well, welcome back to the show. Well, as I said sometime in the show, I said that if you are a church, an individual, or big company out there who feel like doing some corporate social responsibility, Pantan Hospital needs help. The Asylum Down Hospital also needs help, and the Ankafo Psychiatric Hospital also need help. So if you are within this area and you feel you can help, why not? Pop in there and ask for any of the doctors and make your donation. And I'm sure the state and the doctors and the patients will be very, very grateful for that. But doctor, you were telling me how bad things are. I want to hear and then want to see what the way forward will be.
Yeah, terribly, because one in almost every 5 women who deliver will go through some depression, sort of. So almost everywhere in the world where we have people having children, women are going through depression, and no one cares for them. When it comes to the mental hospitals, I mean, we don't have enough to feed the patients. And that is, so sometimes people are ill, you just look on that, because yours is not so serious, let me admit this person and let you go home. And sometimes you have to send people home when you know very well that they are a threat to themselves, to other people, or to property.
But just because somebody is worse, then you have to take that decision?
Yeah, because I have to ration the bed or the space, because if you keep all of them, you're going to end up starving them.
I see.
And sometimes you have to send away because you don't have what it takes to manage. Even though you have the brains, the human resource to manage, because you don't have what it takes to manage a patient, you still have to send away. And I feel it's so bad that in the sense that, you see, people travel to access healthcare. So when you waste their time, you send them away. It's more or less a state punishing you, because we all pay taxes. We all have a right to healthcare. And if I'm denying that right, I think it is very, very appalling, and it's unhealthy as a nation. And this is something that, I mean, I just pray there's...
Doc, I mean, and for those who are, have a little spare change in their pocket, are there private psychiatrists around that you can go and see, or it's the same 12 guys who you have to find one to come and look after you?
I mean, the 12 of us, some of us are private. Not all of us are for government.
Really?
Yeah, and not all of us are working for the ministry. Some of us are teachers. They teach in the university.
How many psychiatric doctors are under government?
Under government, let me see if
5,
I can count.
6?
About 7 of us or 8. Yeah. Yeah, I think about 6, 7 or 8 of us. Yeah. We are not that many. So if you take the directors of the hospitals, then 2 or 3 of us who are also added. That's it. The rest are in the medical school. They are private, practice. Yeah. We have one in Jolu. We have one in Tema. The Holy Trinity. He also manages mental, because the Holy Trinity Medical Center tries to embrace all kind of healthcare. So he has accepted, even though it is for general healthcare, he has accepted to treat mentally ill people there. Then the SPA also actually treats mentally ill people. And that gives a holistic healthcare, total healthcare to those who can, afford it.
It tells you our willingness and our commitment towards the sector. 8 of you is too few. 8 of you is too few. But what is the way forward?
The way forward is to make mental health attractive. Is to make it such a way that people would be happy to work in there. And then we kind of move, we should train people and then make them work in the district and in the general hospitals. The way forward is not to expand a mental facility to put more mentally ill patients. We can expand it and make it more a general hospital and then also mental health care. But let's actually actualize the mental health law. It's a very good law, and when this law is actually actualized, we are going to realize a lot of benefit from it. Unfortunately, in this country, when laws are passed, it takes years or so to see it being actualized. So, but if we can actually accelerate it, I'm sure the mental health law is going to help improve a lot of these services, because
so, are we really saying that in this day and age, if a law doesn't come to say supply food, supply health, provide safety and comfort to the sick, we won't do it?
Yeah, because on what are you going to base to do it? Like the law says, mental health is free. Mm-hmm. So if it is free and government has not given the drug that that will help you, you don't get well.
Doc. Well, it's been very insightful. Folks, that's the real state, and that's our attitude towards mental health. We have grown up stigmatizing them. We've grown up having a wrong perception about people who are ill because they were unfortunate one way or the other. And this is what it is. And I hope that we change for the better and not for the worst. You know what? Tomorrow we'll be back to do it all over again. My name is Nana Ansah Quao, and you are watching PM Express.